She had X-rays.
Yeah.
As a family physician, Dr. Jeremy Rezmovitz sees people from womb to tomb and knows which factors can best protect you from illness. As basic as it sounds, don't ignore your diet.
Number one, eat more vegetables and decrease the salt intake in your diet to prevent a lot of the adverse events that might happen in your life.
The average Canadian consumes more than double the recommended amount, increasing the risk for high blood pressure, heart attacks, and strokes. A great place to start is cutting back on processed foods, which are guilty of providing the majority of salt in Canadian diets. Dr. Rezmovitz says food and physical activity go hand in hand, so either make time for exercise today or illness tomorrow.
It will help prevent many conditions such as heart disease, stroke, decrease the progression of dementia in loved ones that you would know that have that condition, diabetes, and so on and so on.
Physical activity guidelines call for about 150 minutes of moderate, vigorous movement per week, meaning you are out of breath but can still talk. But Dr. Rezmovitz says just aim to do a bit more today than you did yesterday, and that should seep into your entire day.
Biggest impact, I would say, for 2014 that I would recommend is decreasing screen time, as it would decrease the amount of sedentary time that you have and probably increase the non-exercising physical activity. There are little small things that you can do every day in your life that will improve your health. And it's these little small changes that we make. Even just taking the stairs more often you'll feel winded a little bit, but eventually you're going to notice a change.
Another high-impact change is quitting smoking. Dr. Rezmovitz says not to get discouraged, as it takes an average of 7 tries to actually kick the habit.
We have counseling that can help. We have medical interventions that we can do, including the patch or medication that we can start with.
Remember that no one is perfect, and it's about finding a balance that works for you.
I live by the 80-20 rule. I know what the recommendation is, and so I try to meet that at least 80% of the time.
He says any change in the right direction is a good one, even if it's slow. With Sunnyview, I'm Monica Mattis.